Welcome. I'm Judy Ross. I'm the Assistant Director of Aviation here at Mineta San Jose International Airport. And thank you all for coming today to hear this important message. And as you can see, San Jose International Airport remains open for business. I'm pleased to be joined today by our Mayor of San Jose, Mayor Sam Liccardo. On his left is the President of the Board of Supervisors, Cindy Chavez. To my right is our City Manager, Dave Sykes, and to his right is our Assistant Chief of our Fire Department, Reginald Williams. We're here today to address the outpouring of concerns over the past couple days regarding the news that 3 Transportation Security Administration, or TSA agents working here at SJC tested positive for COVID-19, also known as novel coronavirus. First, let me say that all of us here have these employees and their families in our thoughts, and we wish them a speedy and healthy recovery. The health and safety of all our employees on the airport campus and the traveling public is our top priority. Delivering on that priority does take teamwork. Us in airport management rely strongly on our partnerships with our airlines, numerous local and federal agencies, and other business partners to provide you, our community, our travelers, with a safe, secure, and friendly travel experience as you move from the roadways to the runway. The men and women of the TSA are vital partners in that effort. We appreciate all that they do to keep our airport and our skies safe. And as you can see, they continue to work hard at our airport today. Another way we deliver on our priorities is by sharing information that we have that could impact the health and safety of our traveling public and our employees. Earlier this week, TSA informed us that 3 of its TSA agents that work here in San Jose were tested positive for COVID-19. The TSA also advised us that they are working directly with the County of Santa Clara Public Health Department as the agency responsible for public health in our region, and that they are making the best decisions and recommendations for the well-being of our community. And I would like to add that we are working closely with this TSA and the public health to release additional information, and we work tirelessly 24 hours a day in that. And at that point, those are the details that have been shared with the airport at this time. And I would like to note, as of today, the Santa Clara County Public Health Department has not prescribed any special precautions for the airport to prevent the spread of COVID-19. Nonetheless, as soon as we were informed by the TSA of these 3 agents, the airport did conduct extra deep cleaning and disinfecting of both our security checkpoints and high traffic areas throughout the airport campus. We have since added the deep cleaning to both of our security checkpoints to our daily cleaning routine, and that meets and exceeds the CDC's guidelines. I would like to note that even before we were notified, we were performing deep cleanings throughout the terminals every night. We have also added extra cleanings throughout the airport on a continuous basis. In addition, we have provided additional training to our janitorial staff. As you can see behind you, we have posted signages provided to us by CDC throughout the public and non-public areas on the airport campus to encourage our travelers and our employees to wash their hands frequently and maintain good hygiene and self-care habits. As airport management, we focus on doing everything we possibly could do within our control to provide a safe and healthy and pleasing environment as we transform the way Silicon Valley travels. Now I'd like to introduce you to San Jose Mayor Sam Liccardo.
Thank you, Judy.
Thank you, and good morning, everyone. First, I just wanted to comment on Judy's remarks, and I appreciate our hardworking airport team and all that they do every day to ensure that our traveling public is safe. Our thoughts are with the families and with those individuals who have been infected, both with the TSA and indeed in our own city organization. We know this is affecting a lot of families throughout our community right now, and we're going to continue to work hard to serve them and protect the entire public. And we're grateful for all the hard work that our county partners are doing, and I'm grateful that President Chavez is here as well. First, with regard to the TSA employees, thanks to the leadership of our representative in Congress, Zoe Lofgren, joined by several of her colleagues, Jimmy Mineta, Anna Eshu, and Ro Khanna, myself, and President Chavez signed off on a letter urging the TSA to identify the locations and times in which these individuals were working. Of course, we know this is not a threat or risk to the overwhelming majority of the traveling public, but because we know this is a transmission that depends on close proximity of one individual to another, we obviously know that it is important to our community to understand where specific infected TSA employees may have been working at different times. We want to be able to provide that information to the public. And so we are encouraging TSA strongly to come forward with that information so that we can ensure the public knows everything they need to know. Secondly, we're going to continue to have difficult news, and you'll hear some more from Dave and from Chief Williams in a moment. We know something about the trajectory of this pandemic as we see it afflict communities throughout the world. And we know that there will be more tough news ahead. But I want to assure everyone that all of our local authorities are working together as they never have before. And we are strongly united in doing everything we possibly can to mitigate and ultimately to stop this pandemic here in this valley. There is no secret about my feelings about what we need to do more. And at a national level, we are simply not doing nearly enough in terms of testing and contact tracing that we are seeing other communities throughout the world effectively implement to be able to mitigate the spread of this disease. As an example, as of yesterday, about 2,000 people had been tested in the United States, about 200,000 in South Korea. We know what works to mitigate this disease and to halt its spread, and we critically need to ramp up the scale of testing. And that requires much greater federal response, and we are certainly advocating actively for that. I had a conversation with the governor a few days ago about this very issue. He gets it. He understands the importance of it. I was speaking with his team last night on the phone, and they are working hard to get more capacity, particularly with commercial labs, to our county and to other afflicted counties. And so we're going to do everything we can here locally and working with the state, but this is a national crisis, and we certainly need greater national commitment to scaling testing, not 2 times or 5 times, but 100 times, 200 times. There needs to be a dramatic ramp up if we're going to be adequate to this task. I'm confident we are going to be. I know that collectively as a community, we are stronger than this virus. We know there are tough days ahead, but we are going to overcome this, and we're going to thrive again as a community. In the meantime, we urge everyone to please pay close attention to the expert direction from our county public health authorities and the CDC to ensure that everyone is doing everything they can to protect their own families and themselves. And we'll continue to repeat all those messages I know that we've all heard many times before: washing of hands, social distancing, and all the rest. We're going to do everything we can to continue to communicate those messages. Now it's my pleasure to introduce Dave Sykes, who's done a tremendous job here leading us through this very difficult time. Dave?
Thank you, Mayor. Here in San Jose and in our organization, we are now seeing the impacts of coronavirus on the organization through exposure of our employees. And I want to share with you some information about how we are working through that. I want to reassure you all, we are following all the guidance that we receive from the County Public Health Department. I will be asking our Assistant Chief Reggie Williams to come up and share additional information shortly. I want to reinforce that on January 24th, we did as a city put into place our pandemic response plan. And we are in essence implementing that plan currently. We are currently at stage 4, which is the stage that we consider to be high risk. We are actively working with each of our departments to ensure that we are incorporating all of the guidance that we are receiving from the experts. This means changing our operational plans and how we deliver services across the board, and we are certainly taking steps to reduce spread in our community by modifying programs and by proactively canceling events and extra cleaning in areas where the community is in contact. The health and safety of our employees and our community and our businesses and our visitors is our top priority. So I can confirm, as of this week, we have a firefighter that has been tested positive with coronavirus and may have exposed other firefighters. I can also confirm that we are gathering information on a second employee that may have tested positive with coronavirus. Certainly due to patient confidentiality, we will not be sharing information about individuals, but we will be sharing information about how we are managing and working through those issues to ensure the safety of our employees and the safety of our community. I can't stress anymore the importance of the points that the mayor made around testing. That is an important tool for us to be able to contain and mitigate the spread of the virus. And without that, I believe we are flying blind. I will now ask Assistant Chief Williams to come up and share additional information about how we are responding to the impacts to our fire department.
Thank you, City Manager. First responders are on the front lines as we help our community through the difficult healthcare crisis the coronavirus presents. The San Jose Fire Department has been in close contact with the County of Santa Clara Public Health Department, as well as fellow agencies to help with safety guidance. We're providing ongoing direction to protect all of our employees from the exposure of the virus. For firefighters, this includes special communicable disease training, personal protective equipment, and decontamination procedures. The City of San Jose was notified that a firefighter tested positive for the COVID-19. And as the City Manager mentioned, we are following up on the second firefighter. Because our firefighters work in teams, and they train together, and they eat together and sleep in the same areas, they are at risk for possible exposure. We don't know how the firefighter contracted the illness. However, he is in a hospital in another city where he resides, being treated by medical professionals. We are working with the County of Santa Clara Public Health Department on this issue, and currently, employees who have been identified at risk for exposure have been placed on leave. As firefighters are either emergency medical technicians or paramedics, they're able to self-monitor for signs of illness. We have daily contact with them through our fire department infection control officer. In the meantime, we're ordering deep cleaning of our fire facilities. Our department is large, with over 700 active firefighters. We have been able to backfill and maintain our operational readiness. The San Jose Fire Department remains committed to our mission to protect the community through prevention and education. And while fire stations normally welcome members of the public to visit fire stations, the department has suspended all fire station visits and non-essential contact with the community members through public education and outreach activities and attendance at community events. The Center for Disease Control recommends those who think they have been exposed to COVID-19 and develop fever symptoms or respiratory illness, such as cough or difficulty breathing, call their health care provider immediately. And with that, we'll take some questions.
I'm sorry, yes. And the President of Board of Supervisors, Cindy Chavez, is also here.
Thank you. I just wanted to make three big comments. One is that I want to acknowledge the leadership of the City of San Jose Mayor Liccardo and his entire team in working closely with our public health department and with the county. And I say that because there's no time like the present to just be one team, and we really are one team. I also wanted to acknowledge that San Jose International Airport began deep cleanings before anybody directed them to do so. And what's important about that is it means that they're looking at the guidelines that are coming out, some of them that are voluntary, and acting on them. And they did that again before they were told to or anybody asked them to. And I just want to acknowledge that. And lastly, the thing I wanted to say is that you're going to keep getting new information. And every day, the Public Health Department, in collaboration with our partners that you see behind us, are looking at what are the next new steps that we need to take to continue to try to slow this virus down. Our number one goal is to make sure that we do not flood our medical institutions with cases that are, or issues that are less important than really being able to deal with the virus. We are fighting a battle here, and we need everybody in our community to participate. What that means is that if you're an at-risk person, if you're over 50, if you have underlying health conditions, to do as much away from other people as you can. If you can work from home, work from home. If you're worried about your health, self-isolate. And if, for all of us, it's a reminder to wash our hands and not touch our face and wipe down the things in our offices or in our workplaces. Why do I say that? Is it because it's going to take all of us to beat this? I am confident we can do this together, but every single one of us plays a role in doing so. Thank you.
Question for the chief. How many firefighters are affected by this one, possibly two positive tests, and how is the department able to function? You have people that are out, quarantined, etc.
If I could just help the chief with that. So we're committed to getting that number out. We weren't able to confirm the actual number by time of the press conference, but I think within the hour we'll be able to confirm that number. I'll ask the chief to come in to talk about how we can operationalize that.
You have ballpark, like a dozen, 2 dozen?
I can tell you that is in excess of 50.
More than 50 firefighters are out of a force of 700 roughly.
That is correct.
So chief, how does that impact operations? You have 50 of your 750 total out.
So we've been able to backfill, as I mentioned before, our fire department is staffed with over 700 firefighters. And so we have a relief pool, and we have a mechanism for ensuring that all of the fire stations are fully staffed and operational and ready to respond to the community needs.
Backfill means what?
Backfills means that we bring in firefighters who are off duty to backfill vacancies within the department.
Other questions? Yeah, with all due respect, we're frustrated with the TSA, but should we have heard about this earlier? And why can't we find out the flight this firefighter took out of town? So we can cross-check that, see if anybody else might be prone?
I'm sorry, with regard to the flight information?
Yeah, firefighter.
Oh, the firefighter. If you could repeat your question?
Yeah. So y'all are frustrated with TSA. I think a lot of us are. But at the same time, can we get flight information this firefighter took out of town? Who else may have been exposed? Any response to EMS calls or other people?
Right, so we're tracking all of that down, and we will be sharing all of that information. Obviously, as I said, we're not going to share information about the individual, but we are going to share information so that you understand how we are managing through this. As you probably know, it's not the city's role to do the tracing process, but it is our role to make sure that the community and our workforce are safe, and those are the steps we're taking. So any other person that the firefighter has become in contact with has been quarantined.
Ages on these people that have tested positive, both the TSA and the firefighters. I ask that because this disease particularly hits those who are, as you say, over 50, into their 60s and 70s. It gets more severe. So all these victims above or below 50?
Most of our firefighters are below 50, so I think it's safe to say they're below 50. Now, I don't know if we know any more information about the TSA employees.
Is it concerning that healthy, strong firefighters that succumb to this?
I think that we certainly understand that we're all susceptible to it, but it's really people over 50 and other vulnerable people in our population that have more severe impacts from it. So I am not overly concerned that a few of our staff have contracted the virus. I hope and expect them to recover and to be able to return to duty.
Dave, does the traveling public have a reasonable expectation to find out whether they came into contact with these TSA agents who tested positive? I mean, if I flew into San Jose a week ago on a particular flight, will I be able to figure that out eventually?
Our goal is to get all that information from TSA to find out where and when the individuals who were infected were working. Obviously, there's a big difference if there's someone working behind a monitor as opposed to actually doing screening of individual passengers, and we want to find that information out. We understand TSA may be releasing some information today. We don't know what. We are urging them to release that specific information so we know exactly who is working what shifts and where.
Mayor, from what I've heard from the TSA, the three were doing screenings in this building, and apparently, at least in the early going, it seems that one affected the other two. So with that knowledge, is it more likely than not that this could have spread to traveling public who are coming through these screenings?
I'm not going to speculate as to how or what might spread. I think we all pretty well understand the mechanisms for transmission. What we need to know from TSA is exactly when they were working and exactly where, so that way passengers who recollect where they were moving in the airport can at least be informed. So they can self-isolate if they are concerned, for example, if they had an extended pat-down. That is the information we are trying to get from TSA today, and we don't have it right now, and we are urging them to release it. If I could also just comment on the earlier question about the firefighter. Of course, we're concerned about every member of our city family who may be affected by this, and it is of great concern to me, both because every one of our firefighters who are on the front line are serving members of our community, and because they're members of our city family. And so we are going to do absolutely everything we can as we're able to identify the specific activities that this firefighter was engaged in, to understand who we in County Health need to notify who may have been treated, for example, for emergency medical response by this firefighter or others who've been infected.
Mr. Mayor, what is the response from the TSA when you ask for more information? What are they telling you?
They haven't communicated directly with me. I am told they've communicated with either, yes, they have communicated with you, Judy?
We're in constant communication, and so what we're asking is for that type of information to be released by their TSA PIO. And as the mayor indicated, there is some indication there will be more information released today. But we've been sharing with, particularly our federal security director that's on site, the concerns that we're hearing from our community, our travelers, people who traveled through here, what they want to know. So we've been sharing that information with them and encourage them to release that information.
Follow-up question. What exactly, and I know you don't work for the TSA, but what exactly is the holdup? If someone asks me what shift I worked 2 weeks ago, I can say I worked this shift and this is where I worked. So from the TSA's perspective, you have 3 employees, and can't we just say these employees were here at these hours? And what are they saying? Well, give me the information.
Jesse, your question is exactly my question. What exactly is the holdup?
Mayor and Supervisor, do you feel San Jose and Santa Clara County have the number of testing kits they need to get a handle on how many people are infected in Santa Clara County?
No.
And I want to just reemphasize no. And to make this point, we have been given a lot of feedback from the federal government about how we should respond at a local level. My response to that is please get us the kits that we need to test our community. So in fact, we're not only able to be responsive, but we can be informed. Right now, what we're doing is doing our very best, and I have to say this, we've had 2 or 12 people from the CDC embedded in Santa Clara County for about 2 weeks. They have been fabulous, but they can't produce the kits. The federal government needs to do that, and the faster they do that, the better we're going to be able to do our work and protect the people of our community.
And if I could also just emphasize, there is commercial lab capacity out there, as you all know, and we need the federal government's help to ensure that capacity is commandeered to address this pandemic. This is a time when government needs to step in and step up, and we encourage the federal government to do so.
Madam President, is there an effort to lower the population limit to 200 people?
So, yes, and let me just repeat the question for those of you who may not know this. Yesterday, the federal government, in response, I think, to the county of Santa Clara was the first county in the country to have a limit not to exceed 1,000 people for gathering, and to violate that is actually against the law. We have been constantly re-evaluating whether or not that number needs to be lowered. We appreciated getting, and really getting the information from the federal government as to what they are recommending, and we'll be evaluating that on an ongoing basis. What was troubling to me was to get a new number without an announcement of when we were going to have kits arrive, because a big part of our ability to determine and see how this is spreading in our own community has to do with our ability both to know when someone's tested positive and then to be able to do the tracing that the mayor's talked about. But we are constantly evaluating that, and I think we're going to be giving some, as we get new information, we'll be giving new guidance and direction.
Mr. Mayor, what's your response to the president's address to the nation last night? Do you think his actions match his words?
I'll be honest with you, I was on phone calls with the governor's team and handling local matters here, so I didn't actually watch the address. I know the general substance, and frankly, we need test kits more than words. In the city of San Jose, Kip Harkness runs our Emergency Operations Center, started emergency preparations on January 24th. We saw this coming. The county has been working incredibly hard for weeks, seeing this coming, and the demands have been constant. We need testing because the only way that you can mitigate the spread of a pandemic is to test at dramatically higher levels so that you can identify folks who are infected, get them to self-isolate, and stop the spread. Certainly, the county is doing its best to try to identify confirmed cases, but we know the numbers are many, many times higher than that of the actual number of infected residents in our county, and it simply doesn't help us until we know. And I think Dave put it well, until we have the testing, we're flying blind. We need testing capacity.
So in regard to the two firefighters, I just want to get clarification. So one, for sure confirmed, you guys had said the second, possibly. Why possibly? Is that awaiting the test? Is that awaiting test results? Why possibly?
So we did get the results back from one firefighter that came back positive. We've been informed that a second firefighter has their results back. We haven't been told what those results are.
Do you know when you're expecting the kits to arrive? Any information on that?
We have been told that they were going to be arriving in bulk starting Monday. And so I think one of the challenges we have is that we haven't received the number of kits that we were expecting. But I can get more information if folks are interested and release something this afternoon that says how many kits have arrived from the federal government. I do want to just follow up on one point the mayor raised, and that is which I thought was a really important point, that we're also going to be really relying on our for-profit partners to process kits as well, so that we can get to a much higher number. We had a hearing on Tuesday where we asked these very specific questions about what's come in, what can we use locally, and we'll get something out as soon as we have that information.
And I don't know if this walk somebody through the process and what they should do if they have symptoms, what should they go to the doctor?
So if somebody is symptomatic, what they should do is call their doctor and call their doctor's office, and their doctor can help them go through a process of getting tested. Now, one challenge that we have is a lot of folks are calling their doctor in anticipation of being, that they're asymptomatic. And really, we're looking for people who are symptomatic right now. And the reason for that is we don't have enough test kits just to test broadly, but we're hoping to get there. In fact, we were hoping to get there this week.
You said more test kits are arriving this coming Monday.
We were expecting more test kits this week. And so what I don't know is how many we've actually received yet, but I'll make sure we get that out to everybody today.
But there's another batch on the way.
Well, what the federal government has told us is that they will be sending us test kits a few times a week, but I don't know what's arrived yet, but I'll make sure that I get that information to you, because it's a really important question. But let me just say this, if we got 2,000 kids, if we got 3,000 kids, even if we got 5,000 kids, we are a community of 2 million people, and we have already, with the very limited kids we've had, we've tested a number of people to not just be, to be sick. And so we need thousands of kids, and we're really going to rely on both the federal government and our for-profit partners to get us to scale.
And that brings me to the next question. Sorry, what are the requirements to actually qualify for testing?
So right now, what the county is prioritizing is people who have, who we think who are very sick, that we want to determine what their illness is. So they may be in the hospital with some respiratory infection or seemingly a pneumonia or a flu, and so we're testing those folks. We're prioritizing people in skilled nursing facilities because we know the spread in those environments is really high. We're testing first responders, where first responders and healthcare professionals who are on the front lines may be becoming symptomatic. And the reason we're prioritizing those folks is we don't have enough tests just to test everybody. We would if we could, but that's our priority right now.
What does someone do if they do not have a primary care physician? Because we keep on hearing, call your doctor, but there are some folks who don't have a doctor.
They can call the county, and they can call any clinic, any of our nonprofit clinics or any county clinic, and ask to be seen and ask for a test. And I just want to emphasize this. In Santa Clara County, if you do not have health insurance, if you don't have a primary care physician, you can call the closest clinic to your home. We will treat you, and we do that now. We treat everybody in our community, whether they have insurance or not. And it's really important that we don't frighten people with co-pays or extra expenses or any of that. If you're sick, and there's a number of hotlines that we have, I apologize that I don't know it off the top of my head, I really should, but you really can call any county clinic in your area, any public clinic, and we'll make sure that we respond to you.
And I expect the county will be making additional announcements, obviously, throughout the week. So we're going to conclude this unless there are any one last question.
I understand you've had the firefighters tested positive. Has anybody checked the police? Are there any possible positives on the police department?
At this point, we have no confirmed positives on the police department.
Are there any concerns that there may be?
Not yet, no. Nope.
Thank you. Thank you, everyone. Sorry.